Hi, I'd like to give a quick demo of Nlytica. Nlytica is an AI-native analytics application for risk-bearing Medicare organization. A participant data normally lies in multiple different data sources, and all of these data sources are disconnected. You see EMR, you see claims data, pharmacy data, enrollment, meeting notes, and lab results. Nlytica brings all of this data to one place. I can show you where the organization view. Like, in the organization view, you can see the data for the whole organization is pulled from the EMR. In our case, we are using the Epic EMR, and we are using the HPMS operational data, like falls data. And you can see all this data presented here, and all the key metrics that are important for the executives, or anybody who's seeing on the top view. And Nlytica is EMR agnostic, so you can pull data from any different data sources, and you can present that data here. You can see appeals, grievances, medication, risk events, and a summarized organization level view. So as I said, EMR agnostic, so no migration is required. You can connect more data sources in future as well. We'll go to the section where we show the top risk patients. Every patient gets a continuously updated risk course based on their care, and the patients that need more attention are listed here in the risky patient. Let's open one of the profiles. We can open Linda's profile. Linda is 82 years old. She has Parkinson's and heart failure and osteoporosis. Everything about her converges to this one screen: the conditions, the medication, the labs, the vitals from the EMA, the falls, and the visits as well. So you can see the school breakdown here. And you can go inside each and every component to see more details. So what was the reason for her visit? What was the discharge note? And in the cases of fall, where did the fall mostly happen? What are the contribution factors? And when it happened, all those details you can see here. So even her risk timeline. So in the risk timeline, you can see that all the risk events are assessed together at a monthly level time-stamped view. So you can see every fall, visit, weight change, medication change listed across the months. That shows a complete picture of the patient health across the time, and it's enrolled to this whole niche. So now I'll come to our hero feature, that is a care planning feature. So you have seen all this information that is listed here. The patient documents, patient records. You can use this whole information in our care plan. And this care plan takes the complete history and drafts the care plan that is personalized for this user. It's not template-based. It's driven by the patient's own artifacts. So every recommendation site is source. Fall prevention strategy. You can see that there are sick falls that are listed in her mobility section, which we already talked about as present in her falls section. You can also see the weight change was identified earlier. It was also mentioned in the nutrition section. So you can link all the data that was available in a patient history. It's present in the care plan, and the care plan is personalized. And that makes the care plan compliant to the CMS need and follows all the critical component that CMS wants to be listed on the CAP. Now let me show you our third pillar, that is the meeting scribe. So it's not just a transcribing tool. It's a scribe that can be used for the IDT huddle meetings. So we'll transcribe the meeting, but it'll also generate structured, or for each of the patient or each of the participant. You can see that the structure is defined. That's the problem narrative, action narrative, responsible party, and follow-ups. You can redefine the structure, you can create own structure, and create different structures for different meetings. And that this data also goes back and links to the patient profile and can be used in the care planning as well. So I'll quickly go and show you the final piece, that is the chat piece. So this is like a chat GPT kind of interface for your own automation data. So the whole automation data can be linked here. You can connect or lead more data sources, upload documents, and then ask the chat to do anything for you. Like you want to see how many patients had falls in the past 12 months, and can we list the patients having most of the falls? So it will do that. It will get you that information and present that. You can even ask more complex queries, like what are the contributing factors? What are the patterns? We'll do that analysis using the agent that are running in the background. You can use this data to generate visual artifacts that you can publish for the rest of the organization. This is also possible using the chat interface. So this is the code loop. You can feed the complete patient history, See that history in front of you, and then make the plans that are audit-ready plans. So thanks for watching. That's the demo.